Dr. Childress, welcome in the
Thank you.
Humanity Hub. I'm very pleased to ask you a few questions.
Sure.
And it's very nice to have you here in the Netherlands.
Thank you.
I'd say why don't we begin?
Okay.
If it's okay by you. So throughout the interview we'll probably refer to parental alienation.
Okay.
And I know you like to refer to a different term. Could you tell us why?
Okay. So I'm a clinical psychologist. So we're different than the forensic people who deal with the courts. They are more concerned about child custody. We're not. There's basically only 3 custodies, 50-50 every other weekend, or if they live too far apart, it's school year and vacations. And we can work with any of those. So we don't really care about child, we care about fixing things.
Yeah.
Now the term parental alienation is in forensic psychology, it's something they've come up with, but it's not really a thing in clinical psychology. And so there's no good definitions for it, and there's no research base for it. And that's what clinical psychology, we rely on the science of psychology.
Yes.
And what we do is apply the science to the situation, to the symptoms, to the pathology, to diagnose it and then to treat it. And so we have a different focus. And so I don't know what the term means that they're using. I don't have a good definition for it. And there's insufficient research on it. So I'm going to stay away from that. Everybody else uses it, so I have to use it so that everybody understands. But I always put it in quotes to indicate to me as a clinical psychologist it's not a real thing.
Yeah.
For me, what it is, it depends on which information you apply. So let's apply, the best one is attachment. Because a child's rejecting a parent. That's a problem in love and bonding, which is the attachment system. So then first we apply the attachment knowledge, John Bowlby and Mary Ainsworth and all that knowledge to the situation. The other area that's applicable is family systems therapy. Now, we talk about the pathologies as trauma and attachment and personality. Those are pathologies. Family systems therapy is a form of therapy. And there's 4 forms of therapy, 4 schools. Psychoanalytic, that's Freud and the couch. Humanistic existential, that's self-actualization and growth. There's cognitive behavioral, that's the rats in the laboratory and reinforcement schedules and things. And then there's family systems therapy.
Yeah.
We got a family problem, apply family systems. In family systems therapy, the pathology is called a cross-generational coalition between the parent and the child. And so that's the correct, instead of parental alienation, it's a cross-generational coalition. In addition, there's just not only the alliance that the child has with this one parent, there's also what's called an emotional cutoff.
Yeah.
The child is cut off from a parent. Yeah. And so the 2 correct terms are cross-generational coalition causing an emotional cutoff. When we do that, the emotional cutoff, we know where that comes from. It comes from trauma in the parent that's messing with the family and creating all this stuff. So now, not only do we have an attachment pathology, we got a trauma pathology coming through the family. Yeah. So we got an attachment trauma. And so those are the type of things where I want to move away from that vague term and anchor us more into science.
Yeah, anchor into science. And you were talking about parent-child relationship, and I heard you have a very interesting view about relationships. Can you expand on that?
With relationships, there's 4 types.
Yeah.
Father-son, father-daughter, mother-son, mother-daughter. And each one of those is unique. And all of them are equally valuable in terms of child development, equally important in terms of child development. And none of them are expendable. So the father-daughter relationship is not replaceable by the mother-daughter.
Yeah.
It's just a different quality. And so that, in addition, children are from 2 family origins. And they bring together 2 family cultures, 2 family histories, 2 family origins in themselves. So when the child rejects a parent, they're rejecting half of their self-identity as being unable. And so that's where we want to fix things on both sides so that the child can be whole.
Right.
And if you have a difficult parent or a fragile parent, we fix it.
Yeah.
We don't exclude family members. We never do that. If a parent doesn't like a child, they don't kick the child out of the house. And no, we work with them. We fix things.
Yeah. And I guess that is the reason why, if you don't mind referring to parental alienation, why parental alienation is so important and why we need to address this.
There's wonderful research by Ed Tronick out of Harvard called the still face experiments. And it looks like infants and the mom, but it's not really about infants. It's about how the brain works.
Right.
And so we're seeing the basic structure of attachment bonding in that mother-infant. He has 40 years of research on that. And what's important is what's called a breach and repair. So we'll be talking, and then there'll be a little empathic failure somewhere and a little conflict, and then we negotiate back and fix it again. And that's a breach and repair sequence. And they're totally normal, and it's important that we have these in development, because it's like building a muscle of about how to fix things.
Yeah.
So we have breaches, and then we fix them, breach, and it gets stronger and stronger. The thing that we don't want is a breach that's not fixed. Because then the person, the child, never learns how to fix things again. And what happens in their marriage, what happens at work, what happens everywhere when there's a breach. And so when there is a breach like that, and you can see in the still face how devastating it is to the child. Oh, the child is just awful. Yeah. And yet, when we get older, all these kids with the breach, they feel that inside, but we're not seeing it. Oh my gosh, that means all that pain is inside from that and unfixed. And that's the worst thing we can do.
Yeah, we're not seeing it, but we also see that children are in a sort of mindset to say, look, I don't want to have contact with my father, I don't want to see my mother. I mean,
that's what they say.
That's what they say. So
but that's not true.
Exactly, because science is saying something different,
yes,
as you just explained.
The brain says something different.
Yeah.
The attachment bonding to a parent comes from predators eating the kids.
Right.
So if a kid doesn't bond to a parent, the predator eats them. So over millions of years of evolution, we have a very strong motivation to bond to a parent.
Yeah.
And so I have a child saying, I don't want to be with a parent. Well, the predator's going to, that's not true. The child wants to bond. Oh, but the other parent is messing with them. And what's happening is, with the divorce, that parent is so angry at the other spouse that they want revenge on the spouse, and they're using the child as a weapon.
Yeah.
That's more into the domestic violence range. And so I'd say 80, maybe even more of this is about a domestic violence, intimate partner violence, where one spouse is emotionally abusing the other spouse, using the child as a weapon.
And that's strange, because children should be a connecting factor, it should not be a bargaining chip. So,
yeah. And the moment you ask what the child wants, you're making the child a custody prize.
Yeah.
And so each parent then has to influence the child, because we're giving value to what the child wants. And so we put the child up and make them fight over the child's opinion. That's the wrong thing.
Yeah.
No, pull the child out of the middle and make the spouses, it's spouse, but children are off limits. Children are not weapons.
No.
And so we recognize the weaponization of children in Africa or something with the guns and stuff. Yeah. This is a weaponization of children in the court systems of our countries. And the courts and the psychology people and everything is allowing it. Allowing parents to weaponize their children in the spousal conflict. And it works.
Because, okay, so that's interesting, because then we can make the connection to the voice of the child. How should we respond to the voice of the child?
I would say the voice of the authentic child. If I have a prisoner of war, and you put the prisoner of war in front of cameras, and right off camera you have the terrorists or the other people with guns, and America's a bad place, I hate America. Is that the voice of the authentic soldier? Or is that the voice of the coerced soldier? Now, when we have those soldiers making those coerced statements, we all know it's coerced. So why don't we recognize it with the child? When the child is making a parentally coerced statement. So yes, the voice of the child is valuable, but it's the voice of the authentic child. And what is the voice of the authentic child? Love.
Yeah.
What's important to me as a clinical psychologist is not that the child love the parent, it's that the child receives love from both mother and father.
It's one way, is it?
Yeah. And so, well, that's the important way.
Okay.
And so I want the child to feel loved by dad, feel loved by mom.
Mm-hmm.
That's all. Children always want to be loved by mom and dad.
Yeah, of course.
That's normal. So I know the voice of the authentic child.
Yeah.
It's to get mom's love and get mom's dad.
Yeah.
And if there's a problem, we fix it.
Yeah.
That's
So
it. Yeah.
it should reflect in our proceedings, because
Mhm.
what do you think about current current proceedings with regard to complex divorces?
I like the word complex divorce. I think that's what it is.
Mhm.
It's not high conflict divorce. It's just a divorce with a high conflict person in it. So one person's bringing it, and my analogy is to Donald Trump. And if you see Donald Trump, he's a high conflict person.
Mm.
And it's not because everybody is not a high conflict country. We got a high conflict person in a country. And so that's the type of situation. When you get a high conflict person in there, oh my goodness. And so the challenge for the court system right now is trying to identify which parent or what's going on in the family. And so with child rejecting parent, the first consideration is maybe child abuse.
Yeah.
Is that parent abusive of the child? The other possibility is the child being weaponized by this parent. So both factors need to be considered and assessed. Right now, we're not assessing the weaponization of the kid. And so nobody's doing a good, but they're afraid of this other one, and so nobody knows what to do. Because we're using this word parental alienation that has no definition and no scientific basis to it. Once we shift back to science, we can identify which is which.
Yeah.
And so the analogy I used is trauma is like throwing a rock into a lake. You throw it in, there's a rock of the abuse, there's a splash of trauma, and then there's the ripples of trauma through the generations. And what we have to decide is whether this is the rock and the splash, or is it the ripple? And so parental alienation is the ripple of the trauma of a generation before. The rock and the splash was the parent, now it's rippling through. But if we don't understand attachment and trauma and personality pathology and family systems, then we get confused because they look the same.
Yeah.
The ripple has features of the rock in it, and so that's where we need to up the professional knowledge and apply professional knowledge to this situation.
Maybe it's a case of linking the diagnosed treatment and the court agreements all together into one working system.
Mm-hmm.
Perhaps
with the courts, what we're advocating for, I'm advocating for, is that when the court has a difficult situation with attachment and bonding and conflict within the family, the court can decide on whatever custody orders it wants. 50-50, every other weekend, whatever it decides. That's a done deal then.
Yeah.
If there's conflict around that, that becomes a psychology issue. So get a psychology referral to answer your question, who's causing the pathology and what's going on. So don't answer the custody situation, the court can decide that. Answer the pathology question. And so, and then refer out to clinical psychology and apply the science, figure out what's going on, and then tell the court so that the court has the information necessary to make the decisions. In clinical psychology, assessment leads to diagnosis, diagnosis guides treatment. So it's a very step. So start with assessment, you get, and people say, I don't want to diagnose or I don't want to pathologize. But we have to have a diagnosis to know what the treatment is.
Yeah, of course.
If you go into a physician, they need to know whether it's diabetes or cancer, because there's two different treatments. So we must have a diagnosis. We don't want to stay there too long because it's all treatment, but we do need to diagnose what's going on.
But is there a way to standardize this? Standardize the treatment, the assessment, diagnose, treatment, ways of thinking?
Absolutely. Think about it. In clinical psychology, we do intelligence testing, and we provide a bunch of instruments, a bunch of measures, and we compare them to everybody. That's what we do. We standardize our assessments. So yeah, so that's what I've developed as a clinical psychologist, is I worked out the pathology. I've said these 3 symptoms are always present.
Yeah.
And if you do that, then you will identify the pathology. Now, I've done it because I'm a clinical psychologist. People can say, yes, that's good, and use it. If they have disagreement, then come up with your own system for standardizing the assessment. But the assessment has to be the same from you, to me, to them. And because here's the problem. Let's say I'm doing an assessment with you, and I have problems with my own mommy. That's going to come into influence how I see your family situation if I have mommy issues. Or if I've divorced my wife, and I see the woman come in, the mother, and she reminds me of my wife. Okay, then I'm getting my stuff into the family. And so anytime we don't structure the assessment, we're allowing room for personal bias to come in. So we have to eliminate. Your assessment has to be the same assessment, and we rely on data. What's the data?
Yeah, that's interesting. And could it be shaped in the form of a guideline that eventually also legal professionals can use in their assessment?
Guidelines are good, but when it comes to actually diagnosis, I need it even more specific than that. I don't need guidelines as to what your intelligence is. I need specifics. I give you this test, and I can compare it to this number and come up with a number that will allow me to make decisions whether you need special education classes or whether you need accelerated classes. I need some way of giving me the numbers that I can make my decisions. And so that's the level of professional work. Now, guidelines we can offer up at the higher levels, and there's nice ways to potentially structure. So when a family comes into the court system, the court refers to clinical psychology, they do assessment, they provide that, and all of that procedural stuff can be structured very well.
Yep.
But the clinical people have to really be structured, partly because this is going to court. Court relies on evidence, not opinions. Or the opinions are going to have to be based on evidence. So it's getting that ground of evidence that the word parental alienation doesn't provide, science will.
So it's a two-way. It's clinical professionals, clinical psychologists needs to standardize, show evidence in a standardized way, make it understandable in court, make it transferable into a court agreement, and then courts should adhere to procedural guidelines as well.
Yes, and a lot of people talk about difficulties in the court system. I don't hold the courts accountable because this is a family pathology. That's not the court's job.
Right. Yeah.
You know, that's not what they do. It's professional psychology that is not providing the courts with proper information to help the courts make their decision.
Right.
And so that's where psychology needs to develop a much more in-depth, comprehensive discussion so that we can provide the standardized assessments and provide the court with the information the court needs.
So how can we get these two worlds to collaborate efficiently?
We're doing that. And one of the ways to do that is to say things aren't working. So one of my favorite terms on this is scoreboard. It comes out of like sports guys. So when after the game and everybody's arguing, oh, if only this had happened, or there's one shutdown argument for that, which is you say scoreboard, which means look at the score, who won, who lost, bottom line. So for me, we've tried this system for 40 years. Scoreboard. It's not working. Let's do something different. Now, with change, there's always a process of change and stability. Okay? And stability is good, because otherwise change gets chaotic. But stability is also locked in, and it doesn't allow, it's not. And so it's a balance of change and stability. So as we go into this change that we need to have, get the stability from science. That will provide us the stability in the change process. What I would recommend is setting up 3 different models and then get the data on them. And so one would potentially be my model, and you say it's a transgenerational trauma, and this is what I would suggest we do. Give it a try. Then somebody else has another solution. Give it a try. And so we assess things. and then we adjust as needed.
We monitor the whole process, right?
Mhm.
Assessment, diagnosis,
Data.
treatment,
Data.
the effect of the treatment.
On the child's symptoms and everything, and we can look at, and that's the scientific approach to answering questions. Is you come up with your best models, apply the science, get the data, and then make your decision. In addition, the solution that works within the Dutch culture will be different than the solution that works in the German culture and in the American culture. So there's going to be variations about how people work. At the same time, children need the love of both parents.
Because children need the same thing, doesn't matter what country you're from. So the solution should be aimed at reaching the same goal, but the way to do that might be different.
With the psychology legal interface, or with how they do, and yet the same, not Bowlby and attachment is universal across.
Exactly.
And trauma is universal across it. So the knowledge is the same, but how it's applied might be a little variation, and that's okay. So let's try it out in different ways and see what works best. We know what doesn't work the last 40 years, so let's do something different.
I mean, this is something that is applied throughout, the medical sector. You have randomized controlled trials, you have clinical trials. So yeah, you're saying why not?
Exactly. And right now, the reason we don't is because we're stuck on this word parental alienation that gets everybody's opinion. Really nice that everybody disagrees on opinion, but where's the data? And that's what I'm moving us back to. I have my model, because I'm like provoking everybody. I'm saying, there's a solution. Here's my solution. Now, if you have a solution, bring it. But if you don't have a solution, let's do my solution. Your solution. I don't care what the solution is. This is not working. This is not good for the kids.
I have a very, very particular question.
Okay.
This is it scientifically responsible that a child has to split its social life? For example, one parent is allowed to move to another city.
So, when children, I want 100 mom love and 100 dad love getting to the child and being received by the child. I don't care whether that's 50-50 or every other weekend. If it's just every other weekend, I still want 100 love. If it's one parent has a school year and the other parent has vacation, well, okay, I just want 100 mom love and 100 dad love whenever the child's with. Now, knowing I want 100 mom love and 100 dad love, and that it's very valuable and everything, from clinical psychology, if you ask me, I'd say 50-50. Because I can't say mom and son are more important than dad and son. They're equally important. So there's no evidence that would allow me to come up with anything other than 50-50. However, there might be a parent who doesn't live in the same school area. So we need to keep the child in one school. So then we give primacy to that parent, and the other parent gets every other weekend. Okay, I can understand that. I can work with that. Sometimes a parent moves 50 miles away, and so we can't do every other weekend. Well, then we give one parent the school year, and we give the other parent the vacation. That's going to make things kind of messy, because the school year parent has to deal with homework and all this stuff, but they also get a lot more time. The vacation parent gets wonderful, happy vacation time, but they don't get the day-to-day. So there's good and bad with that, but it's what we got to do. And so the courts can make those decisions. The issue is, for clinical, we just want 100 mom love and 100 dad love whenever they're with each other.
That's what you want. Okay, so these are very practical solutions. Then I guess we discussed. I just want to go back once more to this might be a little bit chaotic. Sorry for that. Once more back to treatments. Because I've been to an alienation conference yesterday on Monday. Could you tell us something about the strategic family system interventions, such as single case AB, and
so I'm a clinical psychologist, so I do treatments. And so what I have done is I have applied my skills as a clinical psychologist, my knowledge, to what I would say would be the treatment for this. And so that moves things forward. If other people have other things, bring it. There's essentially what we want is family systems therapy, because it's a family problem. So family systems therapy, I would add another therapy called solution-focused therapy. It stays relentlessly on the solution, doesn't go back to the problem.
Yeah.
Because this is a trauma pathology that always draws us to the past. It's unsolvable. So it would be solution-focused family therapy is the therapy model for this.
Yeah.
Now, on assessment, there's a couple of different approaches you could use. One would be clinical assessment, where I just interview the mom, I interview the dad, I interview the child, I look at mom, child, and the parent together, and then I interview the parents again. And so I'm doing a clinical assessment of symptoms and stuff. That's one model, and I have that in a little booklet form. Another one, though, is if the parent is creating so much pathology in the child that it's messing with the child's life. The child has a fixed and false belief they're being victimized, or it's delusion. And if you're producing a delusion in the child, that's child psychological abuse, when it's resulting in the loss of a parent. When you weaponize a child, that's psychological abuse. Children are not weapons. And so when a parent is weaponizing a child to that degree, then we need to protectively separate the child while we fix them. Then we restore back again. We always want both parents involved. So the protective separation is just for a short period.
Yeah.
Because if I try to change that child and bond, and the other parent is trying to keep the child pathologic, we're going to rip the child apart. So for my treatment period, I need a little zone where we're not ripping the child apart.
Right.
So we can fix the child, and then we restore again. So that's a protective separation.
It's a very interesting intervention. This might be something that could be, available in a guideline. It's really focused on.
It's available right now because of the diagnosis of child psychological abuse. It's on page 719 of the DSM-5. So if a mental health professional makes that diagnosis of child psychological abuse, that then serves as the rationale and justification for the protectives. If I don't have a diagnosis of child psychological abuse, I am not separating a child from its parent ever. Yeah. And so parents are involved until it becomes abuse, physical abuse, sexual abuse, psychological abuse, emotional abuse. I don't care what the abuse is, we need to protect the child. This is a child protection issue, not a custody issue. Now, I know some people, the courts, other people get uncomfortable with separations. And so if you come to me and say, Dr. Childress, is there something other than a protective separation we can do? I don't know, because we always protect the child, all cases of abuse. But you know what? Let me see what I can do. I'm a good family systems therapy, and there's various forms. Most people use structural. There's a different form called strategic. It's really good, but it's complicated. It's really hard to do.
Yep.
I know how to do that. So you know what I'll do for you? I will create a strategic family systems intervention for you that will not require a protective separation. Essentially, though, once we identify that one parent, the pathogenic parent, producing pathology in the child, is creating the pathology, and we protectively separate, we fix the kid, or we identify it. When the child becomes more pathological, we reduce the time with the allied pathological parent and increase the time with the targeted parent. Yeah. When the child returns back to normal, then we restore the custody. And so we're responding, it's a contingent visitation based on the child's symptoms. And so that removes the motivation to weaponize the child, because if you weaponize the child, the other parent gets the child. Yeah. And it's no longer serving your function of retaliating and causing the other spouse all sorts of... And so it's what it's doing is it's interfering with how power is moving in the family.
And there's some form of, I think, checks and balances involved as well.
We always run on the data.
Right.
So it's data driven. So we're monitoring the child's symptoms throughout.
Yeah.
And the nice thing about that is it gives the child power